Good afternoon, ladies and gentlemen. I am very happy to present our work, Vietnam and the Seoul collaboration. I would like to introduce why we did this kind of some collaboration. The principle of our university foundation is love indeed. So we would like to search for some social and public service. And Korea United Pharmacy is a pharmaceutical Korean company, has a local factory plant in Vietnam. And they want some the corporate social responsibility. So this South Korea and Vietnam, Ho Chi Minh City, about 3,600 kilometer distance. Do you remember Vietnam War? And Saigon was the former name of Ho Chi Minh City. Hanyang University Rheumatism Center, so-called HURC, is a consortium between Hanyang University and Korea United Pharmacy. It was established in 2007, but still it is incipient stage. We have some 6 mutual visits and online and telephone communication. The vision of our HURC is to promote friendship between Korea and Vietnam and improve health and the quality of life of their people through medical cooperation and exchange. We have 5 missions. We're still in first stage: communication with some mutual visit, and social service with child medical service or education patient with rheumatic disease, and education to share advanced care for rheumatic disease. Lecture by Hanyang University professor at Vietnam, or training at Hanyang University for Vietnamese doctors. Second stage is some collaborate research and some medical service, particularly for intractable patients with rheumatic disease. So this picture shows some HURC agreement ceremony between Hanyang University and the Korea United Pharm. And the HURC opening ceremony was held in 2007. And I did several lectures in Choray Hospital in Ho Chi Minh City, and attended the Vietnamese Congress, Rheumatology Congress. And we held several conferences at Choray Hospital in Ho Chi Minh City, and also did the bedside consultation at Choray Hospital. According to our preliminary and pilot experience, I found out some obstacles. In the planning stage, I found out some lack of in-depth understanding of healthcare system and insurance system, and lack of a full identification of the needs and the willingness of the beneficiaries. And during the implementation stage, communication is the main problem, particularly language problem. I'm not a native English speaker, and the Vietnamese doctors do not use some English. And also some lack of standardization of patient information communication. And in terms of hardware, some resource such as drug supply availability and some fund. So for action plan, I think it is necessary prior understand some exact status of before implementation, such as healthcare system, insurance payment system, available resource, facility, people, education system, and some quality of care, particularly some their needs and willingness to participation. And the next step is to promote better communications. And the most important thing is to overcome language barrier. There is no golden way to overcome this barrier, but just a reason not here, and standardization of case report forms, and organize local networks. And we need the more effective communication tools, virtual real-time online communication tools such as Facebook or Twitters. And I think partnership and mentorship are both important, but I think partnership is more important than mentorship. So mutual communication relationship is important rather than one-side education, such as small group scientific meeting, educational program, network among beneficiaries. And resource. I think the resources are also important. Some the medication or some raise a fund for networking. We may involve some WHO or some other NGO, and to encourage participation from industry as for some the corporate social responsibility. Thank you for attention.
Thank you very much. I don't know if there's a closing question. The timing and the agenda is extremely ambitious, but I'm getting behind.
Sang-Cheol, thank you very much. You had mentioned creating some standard of communication when you're doing referrals. Do you mean a sort of a template?
Yes.
Where people would, and what, have you done that between your country and Vietnam?
Still, we are preparing because just the standard template is very convenient. Just we online communication and the telephone communication such is quite difficult to communicate between each other.